Okay, Dr. Burley, we do have a quorum.
Okay, great. Thank you, Jesse, and welcome everyone. We'll go ahead and call this meeting of the Medical Advisory Subcommittee to order for Tuesday, January 24th. Thanks for being here and welcome. We'll go ahead and start with introductions. And so I guess I can go ahead and start. I'm John Burley. I'm the EMS Medical Director for Monterey County EMS Agency.
Hi, and this is Jesse Aller with the EMS Agency.
Deborah Hopgood with the EMS Agency.
Kimberly Hernandez with EMS Agency.
Blake Anderson with the EMS Agency.
Steve Brooks, EMS Agency.
Teresa Rios, EMS Agency.
Ben Hitchcock, AMRCES Manager.
Carrie Campman, SVMH.
Noah Hawthorne, Medical Director, Me Memorial.
Ashley Calderon, Natividad.
Sorry, Christy Sobleski, CHOP Emergency Department.
Rub Close, Chomp, and Prescribe Safe.
Devin Haggy, Fort Lincoln Fire.
And is that everybody? And we also got you, Chief Vega, as well.
Yeah, Carlos Vega, Division Chief with Marina Fire Department.
And looks like Captain Alexander as well, Salinas Fire.
Yep, sorry about that. Late join. Ryan Alexander, Salinas Fire.
Okay, well, thank you all for being here. Appreciate it. And we'll go ahead and continue on with the meeting then with our opportunity for public comment. Any member of the public may address the subcommittee for a period not to exceed 3 minutes on any issue not on the subcommittee's agenda. And MAC will listen to all communications but may not take any action. Sir, are there any public comments? Okay, hearing none, we'll move on to the next item on the agenda, which is approval of past MAC meeting minutes. We have 3 different sets of meeting minutes to approve. There's the November 9th MAC meeting minutes, as well as the AB 361 special meeting minutes for December 7th and January 4th. And unless there are any objections, we can go ahead and take a motion to approve all 3 of those meeting minutes.
Jeff Horner, I'll move to approve minutes from all 3 meetings.
Thank you, Jeff. Do we have a second?
This is Ben Hitchcock, I'll second.
Thank you, Ben. So we have a motion on the floor and a second to approve the past MAC meeting minutes for November 9th, December 7th, and January 4th. We can go ahead and take a roll call vote.
Dr. Orchard. I saw him pop on earlier. Dr. Greason,
Aye.
Dr. Hawthorne,
Aye.
Christy Sobleski,
Aye.
Bessie Caldera,
Aye.
Terry Campman,
Aye.
Ben Hitchcock,
Aye.
Jeff Warner,
Aye.
and we don't have Sheriff Nieto.
Okay, well, thank you. The motion carries. And so the meeting minutes have been approved. We don't have any correspondence on the agenda. So the next item is reports, and Teresa Reyes has a report for the EMS agency updates.
Thank you, Dr. Burley. My report will be brief. I was going through all the list of projects that we accomplished in 2022, which is a pretty long list, and it tells me that it was a great year, not because we accomplished everything that we set out to accomplish, but because we were challenged and we worked together as a system, and we did accomplish some projects that have meaningful impact in the system, you know, like the approval of permitted training program, the implementation of the telehealth portion of the ET3, and engaging in the Tri-County Collaborative with Santa Cruz and San Benito counties, which is the first one in my tenure for the buprenorphine administration. And then we also brought back triage tag days, which had not been done in a very long time. We did fall short on some of the other projects, but we made progress. And then we also realized that the system may not be ready for some of the projects that we were trying to tackle. All of these projects were accomplished thanks to the collaboration that we have with our partners. And while there's still many challenges ahead, we've already seen that 2023 started with a bang with the storm. And even throughout those, we see the collaboration that has happened. I just want to say thank you to our system partners. I want to say thank you to our committee members, because you show a great deal of dedication to the system by attending all the meetings, even with the additional 8361 meetings that just adds to your very, very busy schedule. So on behalf of the agency, I want to thank you. I want to thank the EMS team, Dr. Burley, and we look forward to working with you in 2023 in the projects that have already lined up. And there are more. We know that we're tackling the ordinance revision. We're looking at some expansion of the revenue sources for the EMS agency, finalizing some databases that we want to do to make us more efficient. We want to do some work around QI and data cleanup. So we look forward to working with you in 2023 to tackle this project. So thank you again.
Thank you, Teresa. The next item under reports is MOAC activities, and Jesse, you have a report for us.
Thanks, Dr. Burley. So there is a report within the minutes. However, keep in mind that was, I think, the day before the winter storm event. So there's been a little bit of an update since that report was given. Obviously, I think we'll have, as Teresa alluded to, you guys are very well aware of that effort. You guys have done a fantastic job and have appreciated that. Our EOC is still activated at a low level, and our MOHAC is still very active in certain areas of the county. So we're continuing to monitor the situation and work with communities like Big Sur, who are finding themselves still isolated in areas. So no other report besides that, but can take any questions for the MOHAC if needed.
Thank you, Jesse. And I just wanted to take a moment to recognize all the efforts that you and the rest of the team put into the recent winter storms and flooding situation within the county. It was no small undertaking, and I really appreciate all the work that you put in to keep the system running efficiently and to try to make interventions when we could, anticipating potential flooding situations. So thank you again for all that work. I know it was no small task. The next item on the agenda is ambulance patient offload times, and Kimberly Hernandez has a report for us for that.
Good morning. The APOD data is included in your agenda packet. Generally speaking, APOD remains stable through August and November, and I'm happy to take any questions if there are any.
Okay, thank you, Kimberly. That brings us to old business, and the first item on the agenda under old business is the LOSOP for blood and blood product transfusion monitoring. Deborah has a report for us for that.
Just continuing to slowly chip away on creating the educational materials and the application. Otherwise, no significant update to report.
Okay, thank you, Deborah. Next item is MAC membership updates. Jesse, that one is yours.
This was a lingering item that I kind of took over from Deborah, but just a reminder, we do have a couple of vacancies. We're looking to solidify the vacancy from me and also the first responder EMT representative today. But that still leaves two vacancies. One is the primary ambulance provider with AMR, and the other one is a paramedic represented from the first responder fire service. So we'll continue to work on those. There is also a handful of secondary alternate vacancies that are open, and I'll reach out to those primary positions to see if we can identify, make sure we have a quorum for every meeting. So just look for future correspondence.
Thank you, Jesse. That brings us to triage tag days with Steve Brooks.
Well, good morning. To say that it didn't work quite as well as we had hoped would be probably a bit of an understatement. We attempted on, let's see, November, I believe it's 14, 15, and 17, to have every patient transported except a few selected ones who had would not be wise to provide a triage tag on their person. Everybody was to receive a triage tag. We had from AMR on those 3 days, a total of 223 patient transports, and AMR was able to recover 52 triage tags. The SVMH has a few, the TIVDAD and me were, we didn't get any from them, same with CHOMP. So we did a PCR search, a sample of PCRs, and even though we put in the training tool, here's where to record the triage tag number, I just, on my sample was unable to find triage tag numbers where we were hoping to find them. I did find a few within the narrative, but it just didn't work well for that. Now, we did do a lot of communication through our app where we sent out reminders, on push notifications that, hey, today's the triage tag day. We sent out a training, which seems to be a good training, provided some information, reminders about what start triage is. It provided a little video on how to use the triage tag, and then instruction specific for what to do with triage tag day. We sent it in two formats. We sent a PowerPoint to allow the training people to do in-person training. And we also sent it in PDF for a just-in-time individualized training. So we're going to look at how we communicated the trainings, the importance of all this, the setup, the process we used to get the information to the field, and move up the next triage tag days so that we can better accomplish our stated goal, which is to make sure everybody knows how to use them, uses them in appropriate situations, and that we can track our patients from field through to final destination and see if we can't accomplish that better than we did the first time. And with that, are there any questions? Thank you.
Did we get any feedback, Steve, from any of the stakeholders in terms of whether there were any specific identifiable obstacles to initiating the triage tags on the majority of those cases?
There was, and it really came down to the expectations of the field versus the direction that was provided, and how we that we need to look at that juncture and see how we can improve that.
All right, thanks, Steve. The next item under the old business is the 2023 policy protocol review cycle, and I believe that's you as well, Steve.
It is back to me. Forgive me because I've had a little technical issue before I got started. Did we get the public comments into the agenda packet?
I believe we did, yes.
Okay, so you guys should all have the public comments that were received through the public comment process that ended back in, I believe it was November. And then we, yes, there it is, perfect. And then we also, in December, we had open meetings and people could come online through Zoom and provide their comments. So at this point in our process, we're bringing the comments received and the EMS agency response to MAC for a final walkthrough of where we're at with the policies and protocols. And I'm going to answer any questions on any of our responses that you may have. I'm just going to highlight a few of them just so you can see how the process works, when we receive public comments. For example, if you look at our comments on policy 1500, definitions related to the base hospital, it doesn't necessarily sound good, but our definition is right out of the regulations. So we've kept that standardized so that we're not trying to create something new. There was questions about paramedic accreditation and the patient contacts, and we've left the language as it is, again, also because our language comes right out of Title 22. And then there's some questions about if the paramedic who's in their accreditation doesn't make it, do they have to do the full 10? And that's no. The organization that's looking to do the accreditation, if the person's not making it, they're not making it. We'd like to give every opportunity, but they don't have to, do a full 10 calls. But 10 calls gives a better evaluation, so we encourage it. It's up to the accrediting body if they're making that and then reporting to us. As far as the policy 4110 organ donor, what's the intent of this? It comes up, every time we look at this because there's, questions as to what to do with, patient care versus a dead body versus, not disturbing it. Law enforcement needs all of that. Where should they go? It usually stems from an incomplete understanding of the policy, which we tried to highlight here, which is that this is for patients who are still receiving care, but may pass away. And if we have the opportunity to look for an organ donor card, that should be highlighted on receipt of the patient at the hospital so that the hospital staff can move forward. We're not looking to alter anything of transporting people who've expired to do organ donation. So provide care as we do. And, that's just a background, if we can look for it, but it's not the priority. Priority is patient care. We did get a kudo on IO infusion at 4505 that proximal humerus is back in the policy. I will mention that has been in the policy. The training expectation that we'll see later omitted that, and we've put it back into the infrequent skills part of the training that we'll see later. There's some question about the paramedic seldom used skills training, 6090A1 and A2 related to intubation and head trauma and hyperventilation. And we totally agree that we do not want to hyperventilate patients with head trauma. Therefore, we've removed all of that. And we appreciate that as a good catch. In 6090A3, again, our policy for pleural decompression is just the anterior site in the chest. With the training, the seldom used skills, it also talked about the lateral chest placement. So we've removed that for consistency with the policy. We've provided, in 6091D for transcutaneous pacing. we've, again, additional consistency in language with the policy that it really supports. We found that in C2, protocol C2, ventricular fibrillation, pulseless ventricular tachycardia, that we have an inconsistency that's been rectified. And we also acknowledge that, when it talks about consider in that policy, that allows the flexibility of the staff. We want them to transport. It's, when to transport becomes, the point of judgment. We found that there's some inconsistencies in protocol N2, which is stroke, and we've related to the blood glucose levels that were assessed and when to provide blood sugar improvement, with dextrose. So we've made sure those are consistent between N2 and I believe it's N1, which is the hypoglycemic protocol. We had a question about transport, when you should transport the stroke patient to a designated stroke center. And the current thought is 24 hours is the time frame. If the person has new onset stroke symptoms, that they should go to the designated stroke center. So we've updated those numbers. And then for NP2, for hypoglycemia, we've standardized the numbers. Some questions about R3 and the initial title of it, which had a lot to do with bronchoconstriction and wheezing. And of course, we know that many patients with asthma, especially when they get really sick, don't have wheezing. So we've tried to better title that. We provide some responses related to the rhythm of PEA for 20 for traumatic cardiac arrest. And what that has to do with is that there's a side box in that protocol T5 that says, here's the signs of death where we don't start, and use that in conjunction with the heart rate, that we talk about in that box, and which direction you move, whether to initiate treatment or to determine the patient no longer alive. We did, as usual, receive a couple of comments on policies that were not up for review, and we did address those comments. Those are related to consistency between policy 4100, which is determination of death, and our newer policies related to drowning. And there's criteria in there where we can determine the patient to be dead. So we've updated that outside the normal cycle. And then we received some comments from the open meetings, one of which was related to 2-year requirement to be an FTO. We don't have an FTO policy. The state has a 2-year requirement to be a paramedic preceptor. And we followed that during COVID. We made it a 1-year requirement, following again state EMS authority guidelines. But as far as being an FTO, that's an employer responsibility, and the employer determines how long the individual would need to be experienced to be an FTO. We're had a question about push dose epinephrine as opposed to dopamine, and we've referred that to Dr. Burley as a potential future discussion item. And then mag sulfate question, which isn't really related to the condition that they were looking for. And with that, that's a basic summary. Don't want to take all the time. But are there any questions related to our response? Hearing none, I thank you for your attention.
Thank you, Steve. Can you remind us in terms of timeframe, where we are in the process and what are our next steps?
Certainly, good question. Thank you. We are in the process of now putting together the training materials, finalizing the policies and protocols for distribution. The initial distribution of the training materials will be to some key people, training officers within our paramedic providers and some of our EMS, EMT, BLS provider organizations for review to make sure that, what we're thinking makes sense to the people who are going to be using it to train their people. So we're finalizing that. We expect next week to distribute that to the training officers for review. And then the next actual piece will be bringing all of the policies and protocols to this body in March for endorsement. And then we'll be sending them out for training.
And there's, Dr. Burley, there's also a calendar in the packet of the entire project. So, but it's good to review. Thank you for reviewing that with the committee members, Steve. But there's also that calendar in the packet if anybody wants to keep that for future reference.
Okay, excellent. Thank you, Steve and Teresa. And unless there are any other questions, that'll move us on to the next item on the agenda, which is the LOSOP for buprenorphine administration in the pre-hospital setting. Jesse, that is yours.
Awesome, thanks, Doc. So we're excited to report that on December 13th, Dr. Burley and our EMS agency presented this LOSOP item to the state, and it was approved on December 14th through December 31st of 2025. So that's a big win for us. So now we're just kind of going through the last few months of finalizing the project, making sure that we have triggers and notifications set, et cetera. We've got a handful of meetings, a lot of players that include hospital providers and some substance abuse navigator experts, and also EMS. AMR here locally has already started to train their personnel, which was really exciting. I happened to just see a brief moment of one of those trainings, and AMR is doing a great job conducting that. I know that Dr. Close was on, but she may have to jump off. I think she's doing clinics, but is there anything you want to add, Dr. Close, if you're still on before you jump off? All right, we may have lost her already. She did just want me to mention how grateful she is for the opportunity to continue to collaborate with partners and support the good work that she believes in. So no other further reports unless there's any questions, Doc.
No, if I may add, Jesse, that we received a formal letter of approval from the state last week. So, that we have formal approval from them. And I want to recognize the work that you've done, Jesse, in this project. You have great project management skills, and you've collaborated with everybody so well. So thank you for getting us to this point, along with all the agency partners.
Thanks, Teresa.
Yes, I completely agree with Teresa's comments, Jesse. Really good work on moving this through, and appreciate all the time and effort that you put into it. So thank you all for that. I think this will be a great addition to our system, and offer an opportunity for folks to get some relief from the symptoms of narcotic withdrawal, and hopefully start them down a pathway toward recovery. So, this is a multi-step process, but you have to start somewhere. And so I think that this provides a good opportunity for that. The next item on the agenda is health data exchange implementation. And Kimberly and Jesse, I believe that you guys have that on your agenda.
I'll go ahead and take that. This item or this project, the HDE implementation is going to be transitioned over to Jesse, but for now I will give the update. So EMS agency staff and ESO met with CHOMP last week to answer any HDE questions they had. And they're going to be meeting internally to discuss further, and we hope to have an update from them by mid-February. Also, ESO is working on scheduling a kickoff meeting with Natividad. We're hoping that'll be scheduled. We've already met with them once to discuss any questions or anything like that. And we're hoping the implementation call will be later this month or early February. And we're still working to get a meeting scheduled with Me Memorial to discuss HDE, if not an implementation call. Any questions on HDE? Thank you.
Okay, thanks, Kimberly. The next item is MAC bylaws cleanup. Deborah has a report for that.
This item is essentially a placeholder at this point. We will be able to move forward with the item once the changes to the EMS ordinance have been made and the policy and protocol cycle, policy 1020 related to our committees has moved forward. So until then, we'll use this placeholder.
Okay, thank you, Deborah. And the next and last item under old business is the MCRFD EMT expanded scope program. And Steve, that is yours.
Well, thank you again. Monterey County Regional Fire Protection District has applied to be an EMT expanded scope provider. Last year, they applied to, under policy 2211, to be an EMT expanded scope training program. They were approved to be an EMT expanded scope training program. And now they would like to have their people trained and put on the streets to provide EMT expanded scope, which is primarily two main skills. The skill of supraglottic airway insertion and the use of CPAP. Benefit of those, of course, is being able to assist, have their EMTs assist the paramedic in patient care with those things so the paramedic can continue with assessments or other ALS skills and allow the EMT expanded scope trained individual to fulfill maybe the CPAP or airway management using a supraglottic airway. So in your packet, you will see the application rationale, which if you look at policy 4170, there's a various questions or various things that the program needs to meet, and Monterey County Regional Fire Protection District has provided to the EMS agency, and we've of course put in your packet their rationale for why they believe this would be a good thing for their district, for the people who live there and the people who either work or visit the area also. So the next part of that after that is the EMS agency reviews this and makes a tentative determination as to whether they've met the basic requirements. And the EMS agency has completed that. And then the final part of phase 2 of the process is to bring this application to this body, MAC, for an endorsement as to whether this is an appropriate service that we should be bringing to the Monterey County Regional Fire Protection District. While we have provided the tentative determination of approval, it is, we're also looking for this body to review the application, make sure it makes sense, and also provide Monterey County Regional Fire Protection District an opportunity to present anything they would like to this body. And I believe Chief Reyes is here to see if you'd like to address this body.
Sure. Thanks, Steve. So I'd like to acknowledge that when I did contact the EMS agency to move forward with this program, Steve has been instrumental in assisting me with all the requirements and moving through the process. I think this just speaks to the district's dedication to our EMS program. If you look back in the early 2000s, we were one of the only agencies that was authorized to do the combi tube. Upon consolidation a few years later, or a few years before 2010, the Salinas Rural Fire District had moved to be an ALS provider at one of our stations. And in subsequent years, we actually sent employees to paramedic school so that we could be ALS full-time. And then upon the consolidation with Carmel Valley, we entered into an organization that already had an established transport rights as well as paramedics on their engine. So, now fast forwarding to 2023, we're proud to say that we're ALS 24/7, 365. But one of the things that can enhance our abilities, especially in certain situations with our engines only running with 2 people, with 1 paramedic and 1 EMT, is having that EMT having a advanced skill set to assist the paramedic until the ambulance provider gets there on scene with an additional paramedic and EMT. So looking for the MAC committee to move this forward with their endorsement. And again, thank you to the EMS agency with helping us through this process to date. Thank you.
So this is an action item. Again, the EMS agency has made a tentative determination that this is a good use of skill and services in their training. So EMS agency would recommend it. So we'd be looking for a motion to endorse Monterey County Regional Fire Protection District and the EMS agency moving forward to develop an agreement for allowing Monterey County Regional Fire Protection District to provide EMT expanded scope services. That means a member would need to make a motion or ask questions about this.
This is Ben Hitchcock. I'll make the motion.
Thank you, Ben. So there is a motion on the floor now, and do we have a second for that motion?
Jeff Horner with CalStar. I'll second the motion.
Thank you, Jeff. So we have a motion on the floor and a second for Monterey County Regional Fire Protection District to incorporate EMT expanded scope into their service line. We'll go ahead and take a roll call vote.
Dr. Greenson,
Aye. Or yeah.
Dr. Hawthorne,
Aye.
Christie,
Aye.
Cassie,
Aye.
Terry,
Aye.
Ben,
Aye.
Jeff.
Aye.
And I just want to confirm, Josh, you're not a voting member yet at this meeting, so I didn't forget you. And then I just want to confirm that Dr. Kalinsky, Dr. Orchard, or Chief Nieto are not on. I don't want to miss anybody. Okay, thank you. Thanks, Doc.
Okay, thanks, Jesse. And so the motion carries. And so the Medical Advisory Subcommittee endorses this program for MCRFD to incorporate EMT expanded scope into the service line. So thank you all. Okay, unless there are any other questions on that item, that'll bring us to new business. And the first item under new business is the 2023 EMS agency meeting calendar. And do we have a specific staff member that would like to present this?
I can take care of probably the next 3 or 4 items, Doc.
Okay.
The meeting calendar. So Karina from our office did post on our website the 2003 list of meetings. So if you need that or can't find that, please let me know. And then also there is a MAC meeting invite that I believe I sent out or forwarded from her. So if you need that as well for MAC, please let me know. As far as number B, MAC nominations, we're really excited to have Josh. Josh, welcome. I know this is your second time being on this. The first was kind of a weird AB 361 meeting, and you'll get to know what that is as we go along more in depth. The other nominee is Jamie Tovar, who is a nurse from me Memorial. I'll finish with you, Josh, sorry. Firefighter from Greenfield Fire Department, nominated by the Fire Chiefs Association. And then Jamie Tovar, nurse from me Memorial, will also be our second member. Today, both of those nominations are going to EMCC for further endorsement. Once that occurs, Josh will kind of follow the process and send you a welcome packet and all that. As far as number 3, C, committee membership. So I'm going to email those on the committee today, just an individual email. If you could just confirm, number 1, your contact information. I'll also give you a quick reminder of when your term expires. Half of you expire this year in June, and the other half are till next year. So I'll just keep that in your the forefront. And then also, if there's any vacancies alternate wise, I'll be asking you to just help identify an alternate, someone that you work with closely, just so we can continue to keep a quorum as appropriate. That brings us to AB 361, Doc. Do you want to take that one?
Sure, thank you, Jesse. So as you all know, we've been meeting for some time under AB 361 requirements for remote meetings. There was a state of emergency, and it was identified that there would be a benefit to continuing to meet remotely. And so this first bullet point is to consider finding pursuant to AB 361, and in order for the MAC subcommittee to continue meeting remotely, that the COVID-19 pandemic state of emergency declared by Governor Newsom is still in effect. The MAC has reconsidered the circumstances of the state of emergency, and the Monterey County Health Officer continues to recommend social distancing measures for meetings of the legislative bodies. So do we need a motion on continuing, Jesse?
I believe we do.
So this will be an action item then.
We do. So I'll need a first and second.
Okay. So do we have a motion on the floor to continue a meeting under AB 361, continue our remote meetings?
Yeah, I'll
This is
Nick
Carrie.
Greenson.
Lots of enthusiasm. All right, so Dr. Green, I think I got you as the motion, and then Christy, are you seconding?
Absolutely.
All right. This is one of those action items that everyone is like, falling all over themselves to get the motion on the floor. So thank you. Great. So let's go ahead and take a roll call vote on that, Jesse.
Got it. Dr. Greenson,
Aye.
Dr. Hawthorne,
Aye.
Christy,
Aye.
Bessie,
Aye.
Terry,
Aye.
Ben,
Aye.
and Jeff.
Aye.
Thanks, Doc.
You're on mute, Dr. Burley.
Thank you all. So the motion carries, and so we'll continue to meet remotely under AB 361. And that brings us to the next bullet point under this agenda item, which is the next special meeting date. So the EMS agency is recommending Wednesday, February 8th as the at 9:15 a.m. as the next special meeting date. Is there any discussion on that?
And Doc, just a quick reminder, this meeting was originally scheduled for January 11th. And so we decided just internally to keep that AB 361 meeting the same. So we realize it's in just a couple weeks, but better to keep that scheduled as is, because we'll still need one before our next regular meeting in March.
Okay. All right, sounds good. So unless there are any concerns, we'll go ahead and keep that on the books for February 8th at 9:15 a.m. Which brings us on to the next item under the agenda, which is agenda item 8, EMS System Quality Improvement Program, the Continuous Quality Improvement Technical Advisory Group. And Deborah Hopgood has a report for us on that, as well as Blake. I think Blake also.
Yeah, Dr. Burley, I can take that.
Okay,
So,
thanks.
So kind of two birds, one stone, both the STEMI and stroke quality improvement committees have not met since the last report was given to this group. So currently the EMS agency is working on an annual plan for both STEMI and stroke QI. This plan will be a part of the EMS agency's annual plan to the EMS authority, and more will come after the next meetings. In this same fashion, T-Quick has also not had a meeting since the last report. However, some news to update the group, the Verification Review Committee of the American Colleges of Surgeons notified Natividad that they have received an official verification of their level 2 trauma center through November 7th of 2025. The verification confirms that the trauma center has demonstrated and is committed to providing the highest quality trauma care for all their patients. We, as the agency, would like to congratulate Natividad on this significant accomplishment, and with the upcoming end to the state of emergency that's related to COVID-19 and the EMS authority resulting return to the standard requirements for an annual plan submission to the local EMS agencies, we are working on completing a trauma system status report as part of our annual EMS plan. So we will continue to work on reviewing that data and data that's related to the treatment of patients with cardiac arrest potentially caused by trauma. So, and then next on that report is also our CQI tag. The CQI tag met on December 14th of 2022. During the meeting, there was no new business addressed. However, several updates for ongoing topics were presented. Public comments were presented for the 2023 policy cycle review, as were the EMS agency's response in reference to high performance CPR initiative that's been mentioned at these meetings. Both myself and Dr. Burley have informed the group that additional CARES reports were sent to the agency. And also we've been discussing creating educational materials that will be drafted with this project. We also went over the data related to ketamine administration during the second quarter of 2022. Or pardon me, the third partial of the fourth quarter. Also, there was a review of the second quarter for 2022 for the ET3 pilot program. And then next, with Health Data Exchange, the agency continues to work with the local hospitals. It was already briefly given mention on kind of the latest updates with HDE program, with Natividad having participating in the meetings in January, and potential expansion for the HDE participation. Pardon me. So yeah, and much of this has already been addressed. And continuing education opportunities, the EMS agency held a meeting for paramedic preceptors on December 15th. Majority of the current paramedic preceptors attended in person through Zoom. The session was well received for the preceptors who attended. The main focus was the communication of policy, protocol expectations, and documentations for specific circumstances. The discussion was lively and active participation. The agency plans to hold 2 of these meetings each year. Future meetings will continue to highlight specific policies and protocols and training on effective communication and teaching tools. Outside of that, our upcoming meeting dates will be for our STEMI QI is Tuesday, February 7th. TQuick is Thursday, February 9th. The CQI tag meeting will be Wednesday, February 22nd, and our stroke QI will be Wednesday, February 22nd as well. And with that, there's no more to add unless anyone has any questions.
Okay, thank you, Blake. Much appreciated. And that brings us to the next item, which is future agenda items. So this is an opportunity for any items that you'd like to have put on future agenda for the Medical Advisory Subcommittee meetings. Okay, hearing none specific, we'll go on to the next item, which is announcements for good of the order. So any member of the committee may make an announcement or comment, and MAC may not discuss or take any action on any item raised during announcements, except to decide whether to place the matter on a subsequent agenda. So are there any announcements or items for good of the order? Okay, hearing none. That moves us on to the next meeting date, the next special MAC meeting to for AB 361, as we mentioned, will be at 9:15 a.m. on February 8th. And the next regularly scheduled MAC meeting is scheduled for Wednesday, March 8th at 8:30 a.m. Thank you all. That concludes our Medical Advisory Subcommittee meeting, and appreciate your attendance and participation. We'll see many of you at EMCC at the top of the hour. So thank you all, and be safe out there. Have a great day.
Thank you all.